Good evening, my name is Samreen. Can I know your name, please?
Muhammad Yasin.
So, today I'm going to examine your abdomen. Do you have any problem in your stomach?
No,
Any pain in your abdomen?
no.
Before we examine the abdomen, make sure the patient has emptied his bladder. Now ask the patient to lie down and relax. Expose the supine patient lower abdomen by raising the t-shirt to below the nipple line and lowering the drape to the suprapubical level. Inspect the skin for scar, stray, dilated veins, rashes, or ecchymosis. Inspect the symmetry and contour of the abdomen. Observe the contour of the umbilicals to look for the sign of inflammation or hernia or peristalsis or erotic pulsations visible in the epigastrium. Now warm your hand and your stethoscope. Listen for bowel sounds by placing the diaphragm or stethoscope gently on each quadrant. Listen to abdomen before performing percussion because the maneuvers may alter the frequency of bowel sounds occasionally. You may hear the normal stomach growling. If the patient has high blood pressure or erythrosclerosis, listen in epigastric over the aorta, then listen over the iliac arteries and femoral arteries. Next, slightly percuss the abdomen to assess the distribution of tympani and dullness. Tympani is a high-pitched musical sound that indicates hollow space filled by air or gas in the stomach. Dullness suggests fluid or underlying organs like liver and spleen. Now palpate the four quadrants of the abdomen. Identify any tenderness or increased resistance to your hand. Ask the patient to take deep, slow breath for me and just try to relax and palpate gently. Again, having the patient flex the knees is often helpful. Then palpate by pressing more deeply in all four quadrants as you feel for any masses or tenderness. Place one hand on the top of each other. Watch closely for the signs of any acute abdomen for inflammation of parietal peritoneum. Now percuss the span of liver. First locate the mid-clavicular line. Below the umbilicus region starts the percussion. Percuss till the nipple region. Identify the lower border of dullness in the midclavicular line. Next, identify the upper border of liver dullness starting at the nipple line. Lightly percuss from the lung resonance down forward liver dullness. Measure the span of liver dullness between those 2 points. To palpate the liver, place your left hand behind the lower thorax, lifting 11th and 12th ribs. Place your right hand just below the right upper quadrant lateral to the rectus abdominis muscle. Press gently into the abdomen and ask patient to breathe deeply to feel for liver edges as it moves down to meet your fingertips. You need to try again moving your fingertips closer to the costal margin. The hooking technique may also be helpful. To access for tenderness when the liver is not palpable, place your left hand flat on the right lower rib cage. Gently strike it with your ulnar surface of the hand. Ask the patient to compare the sensation to the other side. To palpate the spleen to assess its size, reach over and around the patient with your left hand to support the left lower posterior rib cage. Place the right hand below the left costal margin and place in with your fingers towards the spleen. When patient takes deep breath, try to feel the spleen as it comes down to your fingertips. tip of the spleen is palpable in only 5% of normal adults. Alternatively, ask the patient to turn on the right side with the leg somewhat flexed at the hip. In that position, gravity may bring the spleen forward and right into palpable location to help detect the splenomegaly. Percuse the left lower anterior chest wall roughly from the border of cardiac dullness at the sixth rib to the anterior axillary line and down to the costal lines. This is an area called Chauvet space. As you percuse along this route, note the lateral extent of tympani. Then ask the patient to deeply breathe and percuse again. When the spleen size is normal, the percussion remains tympanic. To palpate the left kidney, move to the patient left side and place your right hand behind the patient just below and parallel to the right 12th rib with your fingertips just reaching the costovertebral angle. Trying to displace the kidney anteriorly, place your left hand gently into the left upper quadrant lateral area and parallel to the rectus muscle. Now ask the patient to take deep breath. At a peak of inspiration, press your left hand firmly and deeply into left upper quadrant. Try to capture the kidney between your hands. If kidney is palpable, assess its size, contour and any tenderness. To capture the patient's right kidney, return to the patient's right side and use your left hand to lift up and your right hand to feel deeply in the right upper quadrant. Proceed as before. To assess the aorta, press the upper abdomen slightly left of midline and feel for the aorta pulsation. Pressing gently with a hand on each side of the aorta, trying to estimate its width, normally should be less than 3 cm. With the patient sitting up, assess for costovertebral angle tenderness. Place the ball of your hand on each costovertebral angle in turn and strike it with the ulnar surface of your wrist. Testing for shifting dullness, percuse the border of tympani and dullness with the patient supine. Then turning patient onto one side and percuse again. Now testing for a fluid wave by tapping on flank sharply with your fingertips while you feel on the opposite flank for an impulse transmitted through the fat. Palpate carefully for an area of local tenderness called McBurney's point, which lies 2 cm from the anterior superior spinous process of ilium on the line drawn from the umbilicus.